going to be demonstrating tape for, we're going to cover all bases here. We're going to be thinking carpal tunnel as well as your common medial and lateral epicondylitis, tendinitis. So golfer's elbow, tennis elbow. With this tape, I am dealing with not pre-cut. So I'm gonna just try to show in real time like how I would cut it to get it rounded on the corners and then measure specific to our goals. Now, you go ahead and point to me where the most symptomatic regions tend to be. Right there in the middle. You don't get here, no nerve.
No, it's just mainly like here. It's almost like it's like you cut the circulation off and it's really, really tight.
Interesting. Well, let me show best practice, which would be to do a little massage first, right? So we're in the business of massage, so it makes sense to try to include those things. Now, for working with the forearms, your shoulder and everything comfortable? Okay, good. You make sure I don't. Is the pressure okay?
Yeah, good.
Now, in general, for all kinds of stuff with the forearms, as I've dealt with a lot of, everybody doesn't think about how much they're always using their hands. It can be, I had bodybuilders and power lifters that had tons of form issues because guess what? Every time they're lifting a dumbbell, they're gripping. Let alone basketball, but cosmetologists, dental hygienists, fellow massage therapists, keyboard, this goes on and on. And if we want a quick go-to with like muscle energy, especially with tendonitis things, like we don't want to dig around there. The tendon doesn't need a lot of stuff. Sometimes you want to counter-irritate it, but I want to go to where the muscles are. And then remembering where their common attachment is, which is all going to be medial here. So the bulk is here. In general, with forearm and particularly wrist issues, you're best suited and safer to do most of your intervention aggressive massage work in this upper half. And then that's going to create slack on these poor tendons. So if I just get a good squash here, be better with my forearm, of course. I'm going to keep applying heat to when the pressure's just right. Okay? Now, without having to think too hard, let's just think of all of the actions I could have her do with the wrist and the hand. So let's go ahead and make a fist, and then roll in real slow circles. Roll in one direction. Good. Change direction. Good. And then slowly relax, open the hand back up. Okay, make a fist again. And just curl your wrist up into me. Strong Popeye. Throw some humor in. There you go, good. Okay, then slowly back. And then really open your fingers up. Really stretch, push back down into the table. Okay, good, just full relax. Okay, fist. And then open the hand up, stretch those fingers. Big, big, big. And then wiggle the fingers around. Play crazy piano. Good. And then relax. And we could keep doing that. Or it could be holding it open. Let me do that one actually. Hold the hand open and roll in a circle. And then switch direction. I'm accelerating this, but you could stay and be pretty thorough. Relax. Okay. Make sure everything can breathe. And then if I'm going to do anything for the tendons, all the way to the carpal tunnel, you're safer to not push them into the skeleton. Try to push them side to side. Okay? So side. That's where all the kneading stuff becomes really helpful. But if I am going to show anything in general for your needs, they don't have to be big. Everybody that worries about how to knead better, you do not need to turn these into huge things, just tiny torsions. Okay. Now we'll say we've worked on this, and all the hand work. Now we hope that we've created an effect. And now, ideally, the tape will help hold that effect, if not do more. Now, measurement time. I tend to, because of the anchors, okay? This answers the question better, and some of these things I don't think about until I'm actually doing it, is if I make the tape end to end go about as far as I need it to, or the working area, then that's gonna be about right. Like if I take this from the wrist to the elbow, once I'm stretching it, that should get my anchors past those points. So if I just kind of go, all right, I want to affect the wrist, I want to affect the elbow, that's gonna be pretty close. I might give it a little bit extra. I would rather, if I'm just constructing this, have a little bit more tape than too little, you know? So these scissors are safety scissors. If you open up too wide, they won't cut. But if you're gonna use this tape regularly, I strongly suggest getting high quality, like nurse, medical grade safety scissors with a little bump. That way I could rest it on a person's skin and trim the tape if I really had to, without worrying that I'm gonna stab them. So if you're gonna do this tape regularly, get these safety scissors. Don't buy these ones necessarily. If you're practicing with these ones, don't open them up super wide. Let me remeasure that line. Okay. And here, and then just following along. All the tape always has like a grid pattern or something on the back. So you'll turn the tape over, use that. Now, I have to round my ends. So then I just turn it back over itself. Or maybe it'd be better to do it this way. I've never really usually cared. I turn it over, and then try to not let the OCD get you as you try to just make a round arc. It's never gonna be perfect. Now, if you did do this, like you could buy a big industrial roll and then pre-cut a whole bunch of pieces of tape. Ones that are like a foot, ones that are 1.5 feet, 6 inches. You could just spend some time chilling out in front of the TV and try to pre-cut as many as you can. I hope I didn't make this one too short. All right, made the anchors a little bit smaller to accommodate that. Now here's the whole thing. I want to make everything here long. So wrist long. You can go ahead and stay relaxed there. That won't affect it. But here, even here, I'm gonna be tracking probably a little bit more medial. So I'm gonna defer to, go ahead and bring it back to center. That's about good. Okay. Now, if I had a way to clean the area more, especially post-massage, I'd make sure hot towel down. And then here. Then roll it over, find the backing. Now, I haven't used this dynamic tape nearly as much as I use the traditional KT stuff. All right, so one section, we're going right here. That's about the right area. Okay. So there's 100. This stuff's a bit hardier than the KT tape. Here. And I'm dialing it back. So I went to about 100, brought it down to about 50. And then I tend to do this. I put it on tension, I hold it with one hand, and then the other hand comes over and pushes it all down. Okay? And take the rest of the backing off. I hold it on tension, dial it back a little bit. My measurement was just about right. Come past, I gotta find. Good. Trying to go right over that common flexor tendon. Now the medial arm, also sensitive skin, so I'd reconfirm for her that we want no irritation. If it starts to get red or itchy at all, then we immediately take it off. Under warm water, if you have any oil, or just really use a ton of soap, like a ton of Dawn soap, you can relax now. So there would be the first one. And then I'd be best suited to go ahead and do the other side too. And then we'll measure that. Okay. And I'd probably just start there and see how it does. You can just see though, it's not too bad. Once you get used to it, you can pre-cut you can cut and measure these in pretty quickly. We got a little bit of a mess to deal with afterwards, but okay. All right, now I have to make the area long, so that's going to be flex and a little flex. Should be right. Okay, go over. Okay, backing off. Hold on to that backing. I hold the anchor down usually because that's when it's probably its most fragile, is we only have a little bit of tape. So I hold that down, find my stretch, dial it back a little bit, and then slowly smooth down. I'm able to just stop. That's the nice thing about this is you can kind of just stop and go, right? Don't take the backing off all at once. Eventually you might get so practiced that you're good. So we want to go right there. I'm palpating for the common extensor tendon. And then I'm just navigating my way there as I go. And I'd even do stuff like this. I'll tug on it. Let me bring this up a little bit. Sometimes I'll just have one hand, the hand holding the tape on tension. I'll give it a variety of tensions. Like some areas might be closer to 50, some areas might be closer to 75. And then I put it down. I figure, hey, I'll do something, especially with the lymph drain stuff. I do things like that. I figure it just creates a variety of an effect. It'll all recoil on some level. Then there. And I'm gonna wait to activate too much. This tape kind of has a smoother texture and quality to it, which is nice. And turn over. Now, for there on those tendons, if I wanted to think about one more thing to do here, if I want to just try to create a lift on that area, okay? So go and point right where it tends to be the most symptomatic, right there on those lines. All right, so let me go ahead and show like a small piece. Well, that's all unraveled, that's okay. That's all right. So let's do just a tiny piece. Turn that over. You could just take the corners off. Like you don't have to do a full U shape. And you could, I mean, I've left corners on before. They just, as I said, they have a tendency to roll up. Right there. Smaller piece of tape can be a bit smaller anchor. And I'm just trying to create an additional lift right over that particular area. So the anchor needs to go on one side. The tape can go over top of itself. You don't want the anchors on the tape though. You want the anchors at least on the skin. They often won't, the adhesive of the tape for the anchored part will not usually hold as well on the tape itself. So right there, going across. Make sure I don't pull that over as I do this. So sometimes I have to do this. As I was pulling, I could feel that I was creating a roll, right? So I may have to kind of hold the skin and make sure I don't cause that. There we go. Okay, now that would be specific. She has what has been diagnosed as actual tendonitis here. But I could have done that same bracket right there across the wrist. There, if you're doing that though, I would have wanted to lengthen here, anchor, lengthen, stretch, go across, then lengthen it here. There you go.
Thank you.
Wow. And then you're right. The coolness of the tape is a factor. And that one has like more of a tattooing quality to it. So, and when you feel this tape, it does have some hardiness, all right? And it's $17 each, so I go with follow your heart, you know, between the dynamic and some of the sport types, but always have at least like a basic original in case somebody's skin is pretty sensitive. All right, and then just check that like everything's down, doesn't look like there's any skin being pinched, mobility good, wrist can go all directions, elbow all directions. And then the next part would be to just, you know, there. So now, again, this could be in pieces. You could do just the elbow, you could do just the wrist, but that's where you could cover both areas. And it makes sense to potentially cover both areas because one correlates so strongly with the other.